Kristen Dancer is a Navy veteran who served as a corpsman in Fallujah in 2006. With the help of VA doctors, Dancer transitioned to being a woman in 2016. I asked her to choose a place that illustrates her new life. She picked a makeup store that she goes to more than once a week. So has makeup become kind of a big part of your life?
It has for me, just because it really helps. The whole art of makeup is to help accentuate what you already have, to take your inner beauty and just accentuate it on the outside.
She gets her medical care at the VA hospital in La Jolla. The VA doesn't offer transition surgery, but it does provide services like hormone therapy, counseling, and speech pathology.
They help feminize our voice, to help put us in a better tone or in a better range and a better pitch.
We talked to transgender veterans about their experience with the VA after President Trump's tweets that they wouldn't be allowed to serve in the military. This was before some of the early details emerged about the actual policy. Like other veterans who made their transition after they served, Dancer fears President Trump's threat to ban transgender service members could change the climate at the VA.
I don't know if that means that, based on his tweets, whether we're all going to get kicked to the curb and we have no place in the VA or in any type of military services.
The VA created an LGBT health program in 2012. A 13-page national directive outlines how transgender vets should be treated. The VA requires each hospital system in the country to have an LGBT coordinator. Jerry Muse is the one in San Diego.
Certainly, coming out now to a provider, we encourage that. You know, it's more like do ask, do tell.
That's a cultural change for the military.
The Joint Chiefs of Staff have agreed to remove the question regarding one's sexual orientation from future versions of the enlistment application.
The Clinton-era policy of don't ask, don't tell didn't apply to transgender people. Even after gay and lesbian troops were allowed to serve openly in 2011, it was another 5 years before transgender service members could do the same. Muse says there are medical reasons to engage with patients about their sexual identity.
Because remember, a transgender woman may still need a prostate exam, and a transgender man may need breast screening and gynecological exams.
The Pentagon was in the middle of coming up with a long-term policy for transgender service members when President Trump tweeted in July, "The United States government will not accept nor allow transgender individuals to serve in any capacity." The military and the VA say they won't change policy without specific direction from the White House. But the Transgender American Veterans Association is worried. Board member Xander Kegg wonders whether troops will be discharged immediately.
Like, it could be that hundreds of people find themselves administratively separated from the military, and they're just thrust into this new civilian life.
Kegg says that could create a sudden influx of new patients at the VA, which could impact care throughout the system, because transgender vets mostly require the same services as other patients. A report by the Williams Institute at UCLA estimates there are 15,000 transgender troops on active duty and in the reserves, and another 134,000 veterans. Defense Secretary James Mattis questions those figures. The truth is, no one has an exact count of how many transgender people have been in the U.S. military. Most hid that part of themselves while they served.
As a trans person, you do such a good job of acting before you actually come out to yourself. I was very conscious of making sure I walked in a masculine manner.
Veronica Zur initially joined the service in 1976. As a retired officer, she was asked to return to duty during the Iraq War. She wanted to serve, but by that time she had transitioned to being a woman.
I couldn't, because that was still in the era of don't ask, don't tell. And let alone addressing any transgender concerns, I very easily could have lost my military retirement.
There was a time when LGBT troops were given less than honorable discharges, making them ineligible for most VA benefits. With so many unanswered questions, Zur and other transgender vets worry they may face the kind of dilemma that they thought was a thing of the past. Steve Walsh, KPBS News.